Hello and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OET training. Today we are going to discuss very important section. Prior to that, welcome back to Magic Pill session. So what topic we are going to discuss today? See, the topic what we are going to discuss today is continuously asked in the exams. So many times they have asked in the exam. So many vital points are there in the content what we are going to discuss today. Okay, so the topic what we are going to discuss today is neonatal resuscitation. So many students asked about the neonatal resuscitation. So as per their request, I am today taking neonatal resuscitation, important MCQ as well as the important points, golden points. Okay, so watch the video till the end. Definitely it will be so much useful for you guys. Okay, so let's begin the session with your motivational thoughts. If you want to shine like a sun, first burn like a sun. It is a very familiar thought, motivational thought. If you want to achieve something, first you need to do hard work or smart work. Okay, so then only if you are doing your smart work or hard work continuously, if you are sustaining in the same thing, definitely on your fine day, you will reach your goal. Okay, so with this thought, let's begin the session. So, as I mentioned already, neonatal resuscitation, all the vital points we are going to cover in this session. So, listen carefully, guys. If you have paper and pen, please make a note of it. Okay. And if you like the video, please like it, share it, and subscribe to our channel. If you have any doubts anywhere, you can drop your message in the comment section. Okay, fine. So, before going to the topic, a small information for you guys, because so many of them aware about the CRE examination, that is common recruitment examination, which is going to be conducted by AIIMS. So most probably February 26 to 28 27 the exams will be there. The tentative date is already announced, and so many students were requested to conduct a crash course for this CRE examination. And as you all know, Metier International Academy always supporting the students. This time also we are launching the course especially for CRE. So those who are willing to join the course, please join as early as possible. The number are given here, that is you can contact this number, that is 9600543642. If you want to text in WhatsApp, the number is mentioned here, 8939890642. Okay, so the free demo class is going to be on YouTube on 18th January 2025, 7 p.m. And the short-term course, it is going to start from 20th Jan 2025. That is in this year. Okay, so with this, let's begin this session. So let me give one introduction. From the introduction, we can start our discussion. Okay, so this is the introduction. I am going to give you a scenario for you guys in this introduction. Okay, so Naomi, it is the name of the baby born by vaginal delivery. So the baby born by vaginal delivery at 34 weeks of gestation. The normal term gestation is 37 to 38 weeks of gestation, right? So 38 is the exact week of gestation, but here the baby born when 34 weeks of gestation. One sec, let me start on the highlighter. Yes, so the baby is born at 34 weeks of gestation, means the baby is a preterm baby, right? Fine. So for this baby, what is happening, at birth, at 34 weeks of gestation, the baby is born by a vaginal delivery, and while delivering, the baby is not at all crying and there is no breath, and the baby is floppy. The floppy meaning is hypotonia. If you are lifting the baby is means hanging like this. Okay, there is no muscle tone at all. Okay, so at birth, the baby is not crying, there is no breathing, and hypotonia, floppy is present. Okay, fine. So after being dried, see, this drying and warming the baby is common for all the neonate, right? After the delivery of the baby, after being dried, warmed and stimulated, still there is absence of breathing. There is no breathing, and the heart rate is very less. There is 65. As you all know, the normal heart rate of a neonate is 120 to 160 beats per minute. Okay, but here the heart rate is very less, 65. So this is the scenario, guys. No crying, no breathing, floppy, heart rate is 65. What to do next? What to do next? Okay, so this is the scenario. So here, one by one, each and every slide, we are going to target on the golden points. Okay, so watch carefully. So the first thing is, till now the baby was in the mother's womb, the fetal circulation was going on. Once the baby came out, immediately after taking a first breath, what is happening? The normal lung expansion and the heart rate is going to be happen. That is, the normal newborn circulation is going to start after the delivery of the baby, after the first birth. Okay, so this is the scenario I explained already to you. Now our goal is to re-establish the breathing and maintain the normal circulation or heart rate, because the heart rate is less, 65, and the breathing is absent. So we need to re-establish the breathing and circulation. So what we supposed to do now? The first thing what we supposed to do now is TABC. Always remember TABC: temperature, airway, breathing, and circulation. Even we can add one more thing also, that is M. TABCM: temperature, airway, breathing, circulation, and medication. So one by one we are going to focus in order to regain the respiration and circulation. Okay, so the first step what we are going to do is, as you all know, it is common for all the neonate. Okay, once the baby delivered, first we need to dry, warm. We need to dry and warm. Okay, so how we can do that? Just wrap the baby with the warm towel, and also we can rub on the back of the baby in order to produce the heat. Okay, so drying and warming, it will maintain the temperature, guys. Okay, as you all know, the normal temperature of a newborn is 96.8 to 99.5. 96.8 to 99.5. Okay, in case of centigrade, 36 to 37. Sorry, 38. Okay, so this is the normal temperature of the newborn. So we need to maintain the normal temperature. How? By wrapping the baby and rubbing the back of the baby. Okay, fine. So that is the first thing. The second thing is, we need to stimulate the baby. Okay, how to stimulate? We should give some pain or stimulation to the baby by just flicking the soles of the feet. See, I am talking about the first step. Already I have explained the scenario. The two main concept is regaining the breathing, regaining the circulation. For that, what we are doing is, the first step is we are drying, warming the baby, and also we are stimulating the baby. How to stimulate? Just flicking the soles of the feet, even by rubbing fast in the back. We are stimulating the baby. Okay, so by doing this, the baby has to regain the breathing and the normal temperature will be maintained. Okay, still the baby is not regaining anything. Okay, now we have to check for what? Airway. Is there any obstruction in the airway? Okay, if you notice any obstruction, only that time we need to do what? Suctioning. Additional suctioning of the mouth and nose is recommended only if there is a sign of airway obstruction. Otherwise, no need to do that. Clear, guys? So first thing, maintaining the temperature is over. Second thing is checking for the airway for any obstruction. If there is any obstruction, then suction is needed. Okay, the next step what we supposed to do is ventilate, breathing. We have to give what? Breathing by positive pressure ventilation. Okay, guys, how to give a positive pressure ventilation? Prior to giving the positive pressure ventilation, make sure you are keeping the baby in the radiant warmer. Very important thing. First, temperature maintenance over, airway checking over. Now breathing. Check just prior to checking the breathing, make sure that the baby is in the radiant warmer. Okay, now we have to start with the bag wall ventilation, otherwise bag mask ventilation. Okay, so this is the bag mask ventilation. It is nothing but they are using the ambu bag and the mask for giving the positive pressure ventilation. All these golden points are very, very important, guys. Please write it out. We are giving a positive pressure ventilation in order to inflate the lungs, inflate the alveoli. Okay, fine. So the positive pressure ventilation, how we are giving? By means of using a bag mask ventilation. How to hold the mask? That is very, very important. In the mask, the C shape, like this we have to hold. C shape is there, no? Okay, so here also you can see the C shape has to just hold the mask tightly, and these three fingers, it should be coming like a E. C for holding the valve of the mask and E for holding the mask and the chin. Okay, so C and E shape has to be maintained while holding the mask. Okay, fine. And one hand for holding the mask and one hand for doing the ambu. Fine. By giving the ambu, what we are giving? We are giving the positive pressure ventilation. Okay, fine. So how much ventilation we can give with the use of ambu? 40 to 60 breath per minute we can give. How many breath? 40 to 60 breath per minute we can give the positive pressure ventilation. Okay, guys. And additional points, see in this slide, what are the things we have discussed? Bag mask ventilation we can use for ventilating the baby. So positive pressure ventilation we are delivering to the baby, and 40 to 60 breath per minute we have to give to the baby. Make sure the baby is in the radiant warmer. Okay. Still the heart rate is not at all increasing. Still there is a apnea and gasping for the baby. Still the breathing is not adequate. Okay. So again, few more important point I would like to add in the breathing. Listen carefully. Still we are giving the bag mask ventilation 40 to 60 breath per minute. Okay. So here few more important point you're supposed to keep in your mind for the exam point of view. That is, for a term infant and for preterm infant, how to deliver the air. For a term infant, a normal atmospheric oxygen is more than enough. While delivering the positive pressure ventilation by using the ambu bag, no need to connect the ambu bag in the oxygen cylinder. Okay, just you can pump the ambu bag so that the environmental air which contain 21% of oxygen will go and deliver to the baby. Clear? I'm talking about term infants or term neonates. Okay, so for term neonates, only the 21% of atmospheric air is more than enough for giving the positive pressure ventilation. Whereas in case of preterm infants born just before 38 weeks of gestation, so for these infant or these neonates, what is needed? 30% of oxygen is needed. Maximum is 30% of oxygen. Okay, the ambu bag, it will be connected to the oxygen cylinder, and 30% of oxygen can be delivered, not more than 30. Here they have mentioned very clearly 100% of oxygen is harmful to the baby. Okay, guys. Yes. So these are all the important point what you're supposed to keep in mind. Okay, so if you're giving effective ventilation, definitely the heart rate will increase. The targeting heart rate and breathing is very, very important, guys. The normal heart rate, as you all know, as I mentioned already, 120 to 160, right? So in this scenario, the heart rate is less than 65. So if you are giving a good effective ventilation, positive pressure ventilation, the heart rate has to increase above 100. Suppose if it is increased above 100, stop the bag valve ventilation, otherwise bag mask ventilation. Just stop the bag mask ventilation, and the baby, assess the baby whether they are breathing spontaneously. If the heart rate is increased above 100, check whether the baby is breathing spontaneously. Okay, if the baby is breathing spontaneously, it is well and good. Okay, just monitor the baby. If the baby is not breathing spontaneously and the heart rate is keep on coming down, that time resuscitation is needed. What resuscitation? Endotracheal tube intubation as well as CPR. Okay, so now we are going to discuss that only. Okay, so here the heart rate is between 60 to 100. 60 to 100. Just keep in mind the heart rate is not increased above the 100. It is just 60 to 100. It is maintaining in between these two. So now the ventilation has to be continued. The bag mask ventilation has to be continued. Okay. So apart from that, we need to start the chest compression also. We will be discussing in detail about two finger chest compression as well as thumb chest compression in detail. No need to worry about that. Okay. So we need to start with the chest compression. At the same time, we need to intubate the baby. Even we will be discussing the diameter of the intubation, that is ET tube. Okay, Fine. According to the gestational age, the ET tube size is going to be changed. We will be discussing everything in detail one by one. Okay. So if the heart rate is not at all increasing after giving adequate ventilation also, we have to start with chest compression and we can intubate the baby or intubate the neonate. Okay, guys. Fine. So the next. So you have intubated the baby. See, the intubation is done. Okay. The chest compression is also started. Still, the heart rate is not increasing. So what to do next? As I mentioned already in the beginning, T, A, B, C, M. T for temperature, A for airway, B for breathing, and C for circulation, and the last M for medication. What medication we can administer while resuscitation? We have to administer adrenaline, that is epinephrine. Okay, so what is the dosage? Very important question, repeatedly asked question in the exam. The dosage of epinephrine during resuscitation for neonate. The dosage is 0.01 to 0.03 mg per kg. Please make a note of it. 0.01 to 0.03 mg per kg. Most of the students will make mistake here. Okay, suppose if they are asking in ratio, that is 1 is to 1000, 1 is to 100, 1 is to 10,000, 1 is to 1 lakh. So in that condition, what is the answer? 1 is to 10,000 is the answer. That is the ratio of adrenaline or epinephrine. They are asking like this, 0.1 to 0.3 mg per kg, that is correct answer. Suppose if they are asking 1 is to 10,000, that is also correct answer. Okay, 1 is to 10,000 means 1 mg or 1 gram, sorry, it is 1 gram. 1 gram in 10 ml. That is called as what? 1 is to 10,000. Okay, so make sure either 1 is to 10,000 is coming, that is also right answer. 0.01 to 0.03 mg per kg, that is also right answer. Okay, fine. So we need to administer epinephrine, epinephrine or adrenaline, okay, in 3 ways. Either one option we can select. Either we can administer the injection in the peripheral IV cannula, or we can go with the umbilical cord. Otherwise, we can go with the intraosseous in the bone. Intraosseous means what? In the bone. Okay. Among these three, any one way we can select and we can administer epinephrine injection to the neonate. Okay. If there is a increase in the heart rate, no need to worry. If there is no good progress, then every 3 to 5 minutes, repeat this epinephrine injection as per the doctor's order. As per the doctor's order. Okay, so all these 5 things, T, A, B, C, M is over. Epinephrine dosage is very, very important, guys. Okay, now you can ask me one question. Sir, when to stop the resuscitation? So we are giving effective resuscitation, but still there is no response. How long we can continue? See, we can continue up to 20 minutes. Effective resuscitation, we can continue up to 20 minutes. Even after continuing 20 minutes, if there is no improvement, then we can discontinue the resuscitation. All these content, whatever discussed so far, it is taken from American Heart Association, a recent edition. Okay. So these points are very, very important, guys. Okay, guys. Fine. So once again, a small recap. Drying, that is maintaining the temperature by drying, warming, and even stimulating the baby, rubbing the baby back and maintaining the body temperature and stimulating the baby. Second thing, checking the airway for any obstruction. If there is an obstruction, just do the suction and remove the obstruction. And third one is maintaining the breathing by means of maintaining the positive pressure ventilation. Fourth one is chest compression. We'll be discussing in detail. And the last one is what? Administering medication. These 5 points, please remember, guys. Okay. So the next thing is, again, we can come back to the scenario. Okay. So the scenario, in the beginning, we have seen that there is a baby with born vaginal delivery, right? And the respiratory rate, there is no breathing and the baby is floppy and the heart rate is around 65. That is what we have seen in the scenario, right? So after doing this effective resuscitation, now the baby heart rate is increased to more than 100. After the resuscitation, the baby heart rate is increased to more than 100. Okay. So now what we can do? We can cease the resuscitation because the baby is spontaneously breathing and heart rate is also increased. Always keep in mind, guys, When the heart rate is increased more than 100, it shows a good progress, good prognosis. And the breathing is also spontaneous, means it is showing a better prognosis. Okay, fine. So these are all the important content I have explained in brief. Okay, so now let's move on to the questions. So far we have discussed a scenario, important golden points. Now we are going to discuss the questions and also the key points. Let's discuss the components of neonatal resuscitation. This is the repeatedly asked question. Components of neonatal resuscitation. 4 options, not 5 options they have given here. Maintenance of respiration, circulation, chest compression, maintenance of temperature, and all of the above. So 5 options they have given here. So which is the right answer here? Component of neonatal resuscitation. Just close your eyes and think T, A, B, C, M. All the 5 things are mentioned here. Okay. So here the right answer is going to be all of the above. All of the above. Okay. Because we have to maintain the respiration. We have to maintain the circulation. Chest compression has to be started and the temperature has to be maintained and medication has to be administered. Okay. So all the 4 options is mentioned here. So the right answer here is all of the above. Okay guys. Fine. Few more additional points. Let me explain. So most of the students will make mistakes here. That's why I added this one. Okay. The first thing what you're supposed to know is neonate. What is neonate? What is the time period of neonate? Infant means 1 year, sir. What about neonate? See, neonate means, please make a note of it. It is just 0 to 28 days. Neonate means what? 0 to 28 days. Even this neonate is further classified into early neonate and late neonate. Early neonate means 0 to 7 days. Late neonate means 8 to 28 days. All are vital points, guys. Okay, listen carefully. Okay, so neonate 0 to 28 days. Early neonate 0 to 7 days. Late neonate 8 to 28 days. Okay, guys. Next. What is the indication for resuscitation? So there is no breathing, floppy baby, and the heart rate is less than 65. Okay. Apart from that, one more option you have to search for the indication of neonatal resuscitation. What is that? Apgar score. I'm not going to discuss very detailedly about the Apgar score, but I'm going to tell the score. If this score is present, means the resuscitation has to be done. This score is present means we need to start the neonatal resuscitation. So what score is that? 0 to 3. If the Apgar score is 0 to 3, we have to start the neonatal resuscitation. Apart from that, if the doctor is suspecting cardiopulmonary arrest, we have to start the neonatal resuscitation. Clear, guys? Yes. So all these are vital points. Okay, make a note of it. The next important thing is, yes, see, in the exams, if they are asking component of neonatal resuscitation, temperature, airway, breathing, circulation. If they are asking principles of neonatal respiration, the answer is going to be same. Component, principle, both are same. Okay, fine. So the next question is the sequence of steps for neonatal resuscitation. This question is also more or less related to the previous one only, but still repeatedly this question also asked in the exam. That's why I added this one. Okay, the sequence of steps for neonatal resuscitation. They are asking the steps, sequence. Already we saw this sequence in the introduction. Okay, in the scenario topic we have discussed right now, right? So in that we have discussed about the sequence. Let's see what they have asked here. See, here they are asking, the first option is airway, breathing, circulation, temperature. So they are asking the sequence. So which one should come first, which one should come second, third, and fourth. Okay. So the sequence of steps for neonatal resuscitation is, any guessings, guys? So here the right answer is going to be option D, that is TABC. Already we know what is the reason behind that. T for temperature. First we need to assess the temperature. Second we have to go with the airway. Third we have to go with the breathing. And the last is circulation. And the very last one is medication. Okay. So here the right answer is going to be option D, that is TABC. Clear? Yes? Fine. So here the very important, very important point I'm going to discuss now. Listen carefully. Okay, all are key points, guys. All the points are golden points. Okay, fine. See, all these points, no, they have asked in the exams. Okay, single points are very important. Listen carefully. See, for this question, the answer is going to be TABC. This is a simple question, but the golden points are very important. Listen, suppose if the heart rate is less than 60 beats per minute, less than 60 beats per minute, as you all know, we have to start the chest compression. First vital point is over. Second, okay, sir, chest compression. What is the ratio? For adult means even for a single rescuer, double rescuer, whatever it is, for a adult, 30:2 is the ratio according to the American Heart Association protocols. Okay, for adult, whether it is a single rescuer or double rescuer, doesn't matter. It is only ratio is 30:2. 30:2. What about for neonate, sir? For neonate, the compression ventilation ratio is 3:1, guys. Please make a note of it. Repeatedly asked question. Okay. For neonate, the compression and ventilation ratio is 3:1. 3 time compression, 1 time ventilation. Suppose if they are asking ventilation and compression ratio. Ventilation and compression ratio, that time 1:3. 1:3. You have to look at the question very carefully and answer the question. Okay, so here I have mentioned compression ventilation ratio means 3:1. Suppose if they are asking ventilation compression means 1:3. Okay, fine. Okay, sir. How long we have to give one compression? How long we have to give one ventilation? Very important question. One compression we have to deliver for half second. Half second. One compression for only half second and one ventilation for only half second. Okay, clear? Yes. So one compression half second means here totally how many compressions we are giving here? 3 compression we are giving. 3 compression means 1.5 seconds we have to give 3 compressions. 1.5 seconds. In 1.5 seconds, here I have mentioned in 1.5 seconds we have to give how many compressions? 3 compressions. Okay, and one ventilation I have mentioned already. So one ventilation is half second. So 1.5 and half together, if you are adding means what answer you will give? You will get 2 seconds. So one compression ventilation ratio is 3:1. Timing is 2 seconds. In 2 seconds, you have to complete 3 compression and 1 ventilation. Please make a note of it. In 2 seconds, you have to complete 3 compression and 1 ventilation. This is called as 1 cycle. So this 2 seconds is equal to 1 cycle. Otherwise, 3:1 is equal to 1 cycle. Again, very important point. In the exam, they will be asking for neonatal resuscitation, 1 cycle is equal to what? 1 second, 2 second, 3 second, 4 seconds. So your answer should be 2 seconds. Suppose if they are asking like 1 cycle of neonatal resuscitation is equal to 2:1, 1:1, 3:1, 4:1. So your answer should be 3:1. Okay. So anyway, they can ask the question. Make sure you are smart enough to understand the question properly and give the correct answer. Okay. So on the whole, 1 cycle is equal to 2 seconds or 3:1 second. Okay. The next one. If they are asking for 1 cycle, 2 seconds and 3:1 is the answer. Suppose if they are asking for 30 cycles, because whatever we are calculating, we have to calculate for 1 minute. That is for 60 seconds, right? In 60 seconds or in 1 minute, 30 cycle we have to give for the patient. 30 cycle means 90 compressions and 30 ventilation we are going to deliver for the neonate. Just compare 1 cycle and 30 cycles so that you will get some idea. Okay, so 1 cycle means 2 seconds and 3:1 ratio. 30 cycle means 60 seconds and 90:30 ratio of compression and ventilation. Okay, slowly pause and read and listen to what I'm saying. Okay, if you're not understanding that, repeatedly watch the video. Okay, the last very important point what we are going to discuss is in this question is total event. In the exam, if they are asking what is the total event of neonatal resuscitation, total event of neonatal resuscitation for 1 minute. For 1 minute. If they're asking means just you need to add 90 plus 30. 90 plus 30 because 90 is the compression, 30 is the ventilation, right? You have to add these two. Okay. And the answer is going to be 120. Okay. 90 compression is a event. 30 ventilation is also a event. So we need to add 90 plus 30, totally 120 event is happened in 1 minute or 60 seconds or 30 cycles. Okay, so these things are very, very important for your exams, guys. Okay, fine. So related to this, few more important points let's discuss, because chest compression, two finger compression, thumb finger compression, how much depth we need to compress, how to calculate the depth of the compression, everything one by one we are going to watch. So watch the video till the end. Okay. See, first we are going to discuss about the two finger method. Here we are going to use the middle finger and the index finger. Very important. First point is what finger we are going to use in case of two finger method. Middle finger and the index finger we are going to use. Middle finger and index finger we have to use. Okay, fine. How to locate the area for the chest compression of the neonate. Okay, here you can see in this image, this is the nipple line. Just 1 centimeter below the nipple line, we have to keep the finger. Once you kept the finger, don't take it out. Very important point. Once you kept the finger, you should not take it out. Okay, so it should touch the skin always. Okay, so 1 centimeter below the nipple line. So this is the nipple line. Just 1 centimeter below the nipple line, you have to keep the two fingers and you have to start the compressions. Okay, so clearly I have mentioned here side for chest compression, that is below the nipple line 1 centimeter. 1 centimeter below the internipple line. This is the answer. Okay, guys, fine. Even for thumb finger compression, this is not only for two finger. Even for thumb finger compression, 1 centimeter below the nipple line. That is the answer. Okay. The next important thing is how much depth we need to give the compression. How much depth we need to compress. This is also very important. In the previous slide, we have just located the area for giving the chest compression. That is 1 centimeter below the nipple line is the exact point where we are giving the chest compression, right? So now the next vital point is how much depth we need to give the chest compression. Here is the answer. 1/3 of the anterior posterior diameter. Underline the key point, anterior posterior diameter. This is the anterior and this is the posterior. Anterior posterior diameter, 1/3 compression we have to give. Okay, so this much, 1/3 means this much amount, 1/3 of the anterior posterior diameter. So this is the anterior and this is the posterior. 1/3 means at least this much of the compression we have to give till from here to here. Clear? Yes. So the key point here is 1/3 of the anterior posterior diameter. Okay, in the exam they will be asking how much depth the chest compression has to be given for the neonate. That is 1/3 of the anterior posterior diameter is the answer. Clear? Yes. So here it is mentioned very clearly, anterior posterior is shown in this image and 1/3 means just imagine here, here to here. Okay, fine. The next thing is chest compression. As I mentioned already, 1/3 of the anterior posterior diameter of the chest we have to give the compression. Okay, and while giving the compression, one hand should give the compression and another hand should kept in the back of the baby by supporting the spine. Okay, one hand behind the baby by supporting the spine, another hand we have to keep and give the compression. Okay, one hand just supporting the baby's spine, another hand for giving the compression. Okay, fine. And as I mentioned already, do not lift the fingers off the chest, because if you lift the finger again for locating in the same area, you are wasting the time. Okay, so you should not waste the time. Every 0.1 second is important. Okay, so you should not lift the hand from the skin. Okay, guys, so one finger supporting the spine, another finger for giving the compression. Next one, sniffing position. So you know that while giving CPR, there are so many ways to open the airway. That is head tilt chin lift method, right? Jaw thrust method. So this method is not at all applicable for the neonate. We should not give this type of method for the neonate. Please make a note of it. Okay. So here there is a special method called as sniffing method. Sniffing method. Sir, what is that sniffing method? See, first let me explain about sniffing method. Roll a towel, keep just below the shoulder of the neonate. Roll a towel, keep the towel below the shoulder of the neonate. Okay, automatically a slight extension of the neck will take place. Mild extension of the neck will take place. This extension is more than enough for opening the airway. Okay, if you are doing hyperextension like head tilt chin lift method, it will damage the cervical bone or cervical membranes. Okay, so we should not do the hyperextension. Even the flexion will also damage the neck bones. Okay, so these two things, hyperextension and flexion, both are incorrect posture. The best posture is sniffing. So sniffing means nothing but roll a towel, keep just below the shoulder. That is more than enough. Okay, guys, fine. That is a sniffing position. Fine. The next important question repeatedly asked in the exam is sniffing position. The next important question is mask. How to place the mask exactly for the neonate? See, the appropriate size mask has to be found out. The mask has to cover the chin, mouth and nose. Here it is mentioned very clearly. Chin, mouth, nose, everything is compactly packed with the mask. Whereas here you can see a small leakage in the chin area. Here the mask is very small. These two are incorrect methods. So a exact mask should cover from the nose till the chin. Clear? Yes. So in this slide, two vital points we have discussed. Sniffing position means what and mask, how to identify it. Okay. The next important thing is, which is the best method? Thumb finger method or two finger method? This is how the questions will be there in the exam. See, both the method we can use, but which is the most preferable method? The most preferable method is thumb technique. Okay, the thumb technique, the two thumb technique is the most preferable method. Okay, when compared to two fingers, thumb technique is the most preferable method. Okay, even while doing the thumb compression, the two thumb has to give the compression and other four fingers should support the spine. Okay, and two fingers it has used to give the compressions. Okay, so thumb method is the best method, guys, preferable method. Okay, the next question is, the baby is very small, preterm baby. Okay, the baby is very small. Now how to give the thumb compression? The space is not adequate. The surface area is very small. If I am keeping the thumb, it is overlapping. What to do now? So now, if the baby is very small, the chest circumference area is very small, you are using the thumb method means overlap your thumbs. One, keep the thumb and just keep another thumb on your thumb. Okay, this is called as what? Overlapping. Then you can give the compression. You can see here, this is the overlapping on the of the thumb, and then you can give the compression to the neonate. If the baby is preterm and very small chest is present means we can use the thumb overlapping method while giving the compression like this. Hope it is clear for you guys. Right? Fine. Next. While intubating, this is also a very important question, guys, repeatedly asked in the exam. While intubating, you know that laryngoscope plays a vital role while inserting the ET tube, right? Without laryngoscope, inserting the ET tube is very difficult, right? Fine. So what type of laryngoscope has to be used for the neonates? In case of term, in case of preterm, in case of extremely preterm. So what type of laryngoscope has to be used for the baby or for the neonate? So here the answer is given here. Before discussing the size, first we should know the shape of the laryngoscope used for the neonate. The straight blade laryngoscope is the one which is used for the neonatal resuscitation, guys. The first important point. Okay, fine. The straight blades, you can see here in this image based questions also very common. You can see here, this is the straight blades laryngoscopes, which is used only for the neonates. First vital point is over. If the baby is term, what size of laryngoscope, straight blade laryngoscope we can use? If the baby is a term baby, we can use this one. That is, the size is 1. Okay, the size number is 1. Straight blade, the size is 1. So this laryngoscope we can use for the term babies. If the baby is preterm, in case of term baby, the number of the laryngoscope is 1. In case of preterm, the number of the laryngoscope is 0. In case of extremely preterm, the number of the laryngoscope is 0, 0. 0, 0. This is for extremely preterm, this is for preterm, and this is for term. Clear? The numbers are important. For 4 vital points we have covered in this slide. The first one, straight blade laryngoscope we are going to use. In case of term, the size is 1. In case of preterm, the size is 0. The extremely preterm, the size is 0, 0. Fine. So this is how we are going to select the laryngoscope. The next one is ET tube size. So laryngoscope I have selected, sir. Now we are going to insert the endotracheal tube. So what size endotracheal tube we need to insert? It is also according to the gestational age and weight of the baby. Okay, let's discuss. Suppose the baby is a post-term baby. More than 38 weeks of gestation. The baby born after 38 weeks of gestation. Just we can keep 40 weeks of gestation and the baby weight is 3 kg. What size of ET tube we have to use? Always keep one thing in your mind, guys. ET tube will be measured with the inner diameter. ET tube should be measured with the inner diameter. Okay, so the inner diameter tube size you have to check. Okay, inner diameter, underline the key point. So the baby is born after 38 weeks of gestation and the weight is 3 kg means we can use the ET tube size with 3.5 to 4. 3.5 to 4 for post-term. In case of normal, that is just preterm, that is 34 weeks of gestation to 38 weeks of gestation and the baby weight is 2 to 4 or 2 to 3 kg. Okay. 34 to 38 weeks of gestation and the weight of the baby is 2 to 3 kg. In that condition, we can use 3.5 mm diameter, inner diameter ET tube. Just if the baby is born in between 28 to 34 weeks of gestation and the weight is very, very less, that is 1 to 2 kg, we can think about 3 mm diameter ET tube. And the last 28 weeks of gestation, below 1 kg, 2.5 mm ET tube we have to use. All these things are memory based things in your book. All the memory in your register, I'm telling, in your notebook, all the memory based things you have to write it separately. For example, formulas, normal values, these kind of memory based content, everything you have to write separately before the examination. Just review it, understand the concept and go and write in the exams. Okay, because there is no rationale behind this. These are all memory based things, so you have to recall again and again. Revision is very, very important. Okay, guys. Next question. In neonatal resuscitation, chest compression to ventilation ratio is, you all know that. Still, this is how the exams questions will be. This question is repeatedly asked. Just I want to show to you. In neonatal resuscitation, chest compression to ventilation ratio is, you all know that, 3:1. 3:1. Okay, fine. So the next question, size of ET tube used for term newborn. The question is term newborn. Okay, let's see what are the options they have given here. 2.5 millimeter, 3.5, 2 to 4, 5 to 8. And here the right answer is 2.5 to 4. Why I have selected 2.5 to 4? Actually, 2.5 to 4 option is not there, right? Fine. So actually the right answer is B, that is 3.5 millimeter. I have made a mistake here. The right answer is going to be 3.5. Okay. See, For a term baby means this is the term baby, right? For the term baby, we have to go with the 3.5 millimeter internal diameter ET tube. Okay, so just correct this answer. That is 3.5 millimeter is the correct answer, correct size of the ET tube. For a term baby, 3.5 millimeter ET tube is the right answer. Okay. The next question is dose of IV adrenaline in term infant during neonatal resuscitation. They are asking the dose during neonatal resuscitation for a term infant. Okay, so these are all the 3 points you have to remember. Adrenaline dose for a term infant for a neonatal resuscitation. Okay, let's see what are all the options they have given here. So already you know the answer is option C, that is 0.01 to 0.03 ml per kg or mg per kg. Okay, actually it is not ml, it is mg. 0.01 to 0.03. Here you can see 0.01 to 0.03 mg per kg is the right answer. If they are asking in ratio, that is 1:1000, 1:10,000, 1:1 lakh, then the right answer is 1:10,000. If they're asking in mg per kg, 0.01 to 0.03 mg per kg. If they're asking in ratio like this, then the right answer is 1:10,000. Clear? Yes? Fine. So these are all the important topics, guys. Important questions repeatedly asked in the exams. Mostly all the important points we have covered here. Okay. From the scenario till chest compression, till medication, how to do the bag wall ventilation, size of endotracheal tube, each and everything, all the important points very repeatedly asked in the exams are covered in this video, guys. Okay, so if you have any doubt anywhere, you can drop your message in the comment section, and if you like the video, please like it, share it, and subscribe to the channel. Okay, fine. As you all know, as I mentioned already, the CRE it is going to be start from 18th of January, so you can call and book your seats. Apart from that, if you are targeting NORCET 8 V14 batch bridge course is running in Pondicherry as well as in Delhi. In Saket branch, we are running the course which we are focusing on NORCET 8. So if you are willing to join, you can just call to the number which is mentioned here. Okay, and just book the seat as early as possible and clear the exams in the first attempt, guys. Thank you very much for watching the video.